Hello and welcome to West Texas VA Healthcare Systems Vital Signs Podcast. I'm your host, Michael Cole, and I'm here with a very special guest today, Miss Tammy Waid.
Thank you. Nice to be here.
Great to have you here. So tell our audience a little bit about how long have you been at VA and kind of the jobs you've had over that time.
Okay. Well, I've been at the VA for almost 13 years now. When I started, I was a secretary for the nurse executive, and then became her administrative officer, and then the administrative officer for the associate director, and then the EA to the director. And during that time, I've had a couple details over to community care to help out whenever they didn't have a chief. So that pretty much wrapped it up, most of it in the director's office.
So we have the boss's boss with us here today. But you try to keep him straight, right?
I don't know about all that.
I think you do pretty well at trying to keep Mr. Cave straight.
He keeps himself pretty straight.
He's pretty good at it, but okay, I better stop. I kind of like my job. But I asked Tammy to come talk to us today specifically about community care. Out here in rural West Texas, we do send a lot of care out on the community.
Yes, we do.
And that whole system, that whole process can be a challenge.
Yes.
It just is.
Mm-hmm.
So I kind of want to talk about some high-level things that maybe our staff, and this, by the way, this Vital Signs we're doing a little differently. Typically, we would record two, one directed at our staff, one directed for our veterans. You know, and we tweak it to that audience. But I think this information is good for everybody,
True.
Whether here in West Texas VA staff or our veterans.
Right.
We all need to know about this.
Right.
So we're going to talk about some of those high-level things about community care that it's important for our veterans to know so that you can best utilize the system that we have in place for you and work well with our community care office as well as the providers out in town. So generally speaking, what do you think some of the top level things our veterans really need to understand about community care?
Well, I think probably most already understand that there has been repeated changes over the last many, many years as the VA has tried to improve upon how we manage care in the community. And so even up until recently, over the last year and a half, a lot of significant changes as the VA tries to standardize how we provide care out in the community. So one of those changes was the new Community Care Network.
Mm-hmm.
With that came a lot of new programs, and sometimes they worked well, sometimes they didn't. And we provide feedback, but the Community Care Network is a tremendous change. At one time, we did the scheduling, and then Tri-West, everybody knows, was involved doing the scheduling for us. And now it's back to us again to do the scheduling. But the big thing is that the providers that we send them to have to be on this network.
Correct.
We cannot send them to anybody that's not in network.
And we have means here to go out and reach out to providers. If there's a provider out there we think would be beneficial for our network.
We could, but that's about the limit of what we're allowed to do.
Correct.
Is to just go out and engage,
Correct.
Give them the information they need.
But talking to our veterans, if, let's say, I'm from one of the more rural communities and there's a dermatologist in town that I've been seeing for years. It wouldn't hurt for us to reach out and say, or we can, and we're not going to get in trouble to say, hey, here's the process for getting
Yes, that's true.
into the network, and then they can take it up with Tri-West and get put in that network. So word of mouth advertising, right?
True, and we do have that. We have veterans that'll reach out to us and give us names of providers that are not on the network. They may be interested or maybe they don't know. So we reach out to them and give them the information they need to reach out to Tri-West.
So there's one big thing. If you have a provider out there, they're not in the network, hey, let us know. Let your provider know. Let's get the two sides hooked up. And if it works, great. We get them in the network. That's just a bigger network of providers we have to be able to send our veterans out to. But I think some of the more challenging things that at least for me, as a non-clinician, as somebody who is only topically aware of community care, communication between the community provider and the VA. It's crucial.
Yes.
So that we can get those records back.
Yes.
What would you recommend if we had a veteran walk in and say, hey, went out to see this doctor. We'll go back to the dermatologist again. How do you guys get the records?
So ideally, the process would be that they would send us the records after the appointment. As soon as the records are ready, they fax them to us. We have dedicated fax lines for different types of care, just so that we can weed out the ones that are high priority, diagnostic testing, request for additional service that they might need, so that we can focus on those first. But ideally, they would fax them back to us. If they don't, then we are reaching out and calling them. We did set aside a separate group within community care that all they do is focus on medical records and getting them back.
Because our primary care providers need that information.
Yes.
If they're going to help our veterans with follow-on care, things of that nature, these records have to get back to us just as quickly as we can so our docs can take a look and say, what's next?
Yes.
Right. So mention that to your provider. If you're going out there and you're on the community care, hey, doc, can I follow up with you about getting my records sent over to the VA? Here's the number. And we have little cards, flyers with those numbers on it. And if we don't have the right number on it, and I'll check with Tammy after we get done recording this and make sure we have the right numbers, we'll get that number out to you. One of the other big things I know working with the patient advocates, we hear from time to time, probably more recently, or more times than not, prescription medications.
Yes.
So I go out in town and I see my dermatologist, and my dermatologist gives me a prescription. Says, here, go fill it. Mm-hmm. Probably not the best way to deal with that prescription.
Probably not. If you want it filled through the VA, then it has to come to the VA. You can't just go to any pharmacy.
Right. So probably I should tell the doc, hey, would you mind faxing this over to our pharmacy? Because I know our pharmacy has a line to receive those.
Yes, they do. They do. They have a line where they can send them over electronically.
So the docs out there in the community can send that prescription straight into our pharmacy, and then Dr. Thompson and his crew over there will take it from there and make sure that prescription gets filled in a timely manner.
Yes, but they also have to follow the VA formulary. So
correct. That'll
be reviewed by the pharmacy to ensure that we're following the national VA formulary. And as long as it does, then there shouldn't be an issue with filling that.
With getting those filled. And when Tammy's talking about the formulary, so there's a whole Bible of medications that VA can provide. And if it doesn't exist in that formulary, we can't get it.
Right. Then that's where they will get with the provider and make a recommendation for an alternate.
Sure.
That is on the formulary.
And more basically, the community care process. So I went and saw my primary care doc, and he says, okay, we're gonna send you out for dermatology. Generally speaking, what does that process look like, and what can the veteran do to help make sure that everyone stays on top of that and is moving in the right direction?
Okay. So once the primary care provider enters a consult for one of our veterans, it gets sent to community care. Our RN reviews it to ensure whatever is needed by that community provider that is included with that consult. So if there's diagnostic testing, lab testing, anything like that, the nurse is reviewing it, making sure we pull that information out of the chart and get it sent over to the community provider so that we can expedite getting things scheduled. There have been times when, maybe we didn't have everything we needed and had to send somebody out for diagnostic testing prior to sending them out to get a specialty care taken care of. And those times when we don't have the information readily available, then it could cause things to
delays down the road. So the key here is making sure we keep those lines of communication open and make sure the providers are making all the right notes in the right places so that the team over there in community care knows precisely what needs to be ordered and in what sequence.
Yes.
So critical. Ask your doc about it. When you're in there for that meeting and your doc says, well, I'm going to write a consult for you to go out and do this, that, or the other thing, talk to them about it. Say, doc, what does this look like? What do I need to know? Do I need to go get labs first? Do I need to get an x-ray first? Do I need to do any of these other steps first? Be informed about what precisely they're doing for you. Because I've run into this, here. I'm a veteran. I get my care here. And simply not understanding. So I had to keep asking that why or what or where. And the docs work in this world every day. It's common knowledge to them. And sometimes and I do this too, talking with my staff about communication and doing the podcast, I understand what I'm saying. They may not very well. So they've learned. They keep asking me why. Kind of like well, never mind. No, that would be mean. I can't say that. So that we make sure everyone walks away from that conversation with the same understanding. So don't be afraid to ask. Ask your doc, ask your nurse. I love my nurse down in my PAC team. Christine is wonderful. And she knows my face now. She looks at me and she goes, you don't have a clue what I just said. No, I don't have a clue what you just said. And she knows that about me now. So sometimes I don't have to ask why. She sees it on my face and she just brings it up. So don't be afraid to have that conversation. Don't walk away with questions. Okay. We have the team here to answer those questions. We might have to do a little digging. We might have to pull in some help, like Miss Tammy Waid here, who has more experience in community care than pretty much everyone else in our facility. But that's okay. That's what we're here for. Don't walk away from those conversations without having a very clear understanding of what's going on. Would that probably sum it up pretty well?
Right up to the part where you said that I probably know more about community care than anybody else here.
She definitely knows more than I do. But I mean, this is why so Tammy had to go over and take over that shop for a while because we didn't have a chief, and it's too important not to have somebody kind of holding the reins and directing things.
Sure.
Me? Yeah, you didn't want me over there. But anyway, that's what Tammy Waid has done for us here. She's so knowledgeable about, and she's the one I run to when I have questions. So we do have a great team over there with Angela Getz and they're
Letitia Ruiz.
And Letitia, yep. And they were in. We actually had conversations like this with them. So it was wonderful to have them in. And this is just a brush up. This is just another touch point. We're going to probably come back to community care more routinely as this grows. And as we bring more stuff on board that we can provide here, we'll let you know that too. Then we don't have to send you out in town for the community care, which is a great thing.
That's true. We are working towards that.
We are. We're doing like we're looking for tele-oncology. And
we're looking for tele-oncology. We're going to increase teledermatology. And a lot of times that equipment that they use, they can see things a lot better than the human eye can see.
Oh, indeed.
So that is it's a tremendous program. We're looking at endocrinology and potentially ortho, not the surgery part, but maybe
the follow-up and the
initial
and that sort
consultation part.
Podiatry?
Podiatry, yes, we have that now, and we're expanding it to our VA clinics out in other areas. So we are doing that. I can tell you something we are doing. We recognize that there have been a lot of frustration with community care. And it's all around, I can tell you that, with VA employees and our veterans, community providers. So we are working very hard. We have a massive improvement project within this facility going that'll impact how we do the things that we do and improve the efficiency of what we provide and the customer service of what we provide. And that's all coming in the next several months. And
this is a conversation I just had earlier today. I was on a conference call with the it's the Abilene Veterans Council, Military Partnership Council in Abilene. And this is the exact conversation we were having. Hey, look, we are hearing our veterans. Your voices are not falling on deaf ears. You have a crew here that really do listen and take that to heart. And we get folks like Miss Tammy Waid and Bridget Holmes and Janae Cranen and a few others get together and say, okay, this is obviously something we need to look at doing better. And then we put people in charge of making it. And that's where we're headed here. So if you have something out there you want us to touch on, you want us to talk more about, we're happy to do it. Send us those messages. Put it in the comments below. If you're finding this on YouTube or if you're listening to it through the podcast, whichever means, reach out to us. Let us know. We're happy to cover these topics for you. We want to cover these topics for you because the better informed each of us is, the better we can do for everyone out there. Tammy Waid, thanks so much for taking the time. I know you're busy. I really appreciate you coming in and chatting with us today. This has been Vital Signs Podcast. I'm Mike Cole, your host, and we'll be back with you again in 2 weeks.